Thank you for signing up to watch Enabling Mobility and Collaboration for Healthcare, delivered by Bob Petitt as part of the Intel Healthcare Plus webinar series. Physicians now carry tablets where they used to carry clipboards, and this is transforming the patient-physician relationship. Getting access to accurate, up-to-the-minute data is essential in today's hospitals.
Hi, my name's Bob Petitt. I'm the global lead for business client mobility and collaboration with Intel's Healthcare and Life Sciences Group. I'm here today to talk to you about mobility in healthcare. There's a number of key trends that we see shaping healthcare today, including payment reform and policies that are shifting from a procedure-based care delivery model to a value-based care model. That means patient outcomes are very important. Providers and payers are being reimbursed and are being measured on patient outcomes. So this is a huge shift. It's happening all over the world at different rates, but we're seeing that trend globally. We're also seeing patient engagement, member engagement, as a key trend in healthcare. And what that means is getting the patient involved in their own healthcare and keeping them involved. As a patient stays involved and follows a doctor's care orders, that leads to better outcomes. And that is a huge focus for providers, especially in the US markets and in some of the other markets where reimbursement is based, in part, on how the patient satisfaction is measured and what the outcomes are led to. And that is a huge part that's driving healthcare policy and reimbursement shift. Security is a huge issue in healthcare. Securing patient data is a priority everywhere. Intel's very focused on enabling mobility and collaboration technologies with security features. And I'll talk a little bit about what those security features are. And then digital transformation is also a huge issue as hospitals, providers, clinics are all moving away from pencil and paper and moving to a digital workflow. And that includes adding mobility and mobile applications. Intel sees three big focus areas where we can influence and enable and improve the use of mobility in healthcare. That includes in the acute care settings, in the hospitals, streamlining workflows and just speeding up those workflows, making them go faster. And that allows doctors and nurses to see more patients, and that leads to better outcomes and better patient satisfaction. We also see community care as a big focus area and enabling access to the data even after you leave the hospital. For a doctor or a nurse who's visiting a patient at home, having access to that care data is critical to delivering the right care at the right time with the patient outside of the hospital. And then patient engagement solutions that allow the patient to actually have a mobile device themselves or an application on a mobile device like a 2-in-1 gives them access to the data after they leave the hospital. This leads to better informed patients, and it leads to better outcomes and a reduced cost if the patient doesn't have to go back to the hospital. Mobility is enabling new care options, new ways of delivering care. Consumers have mobile devices at home. They're bringing them to work more and more all the time. 2/3 of people who work bring mobile devices into the workplace. And when we talk about at the workplace, mobility options are critical because 80% of people who actually go to an office to work typically go out of the office to collaborate with their peers while they're doing their job. This is never more evident than in healthcare. You go to the hospital, you see nurses and doctors collaborating, moving around the hospital. Mobility is critical in healthcare. The improved patient outcomes, the improved patient experience, and the reduced cost of care as a result of using mobile devices makes it worthwhile. 2-in-1 devices enable clinical mobility. Intel's focused very hard on enabling the use of tablets and laptops in healthcare environments. A 2-in-1 device enables you to do the same thing with one device. A 2-in-1 is essentially a laptop with a screen that can act as a tablet, can be detached and carried around as a mobile device. And it can also be reattached to a keyboard to enable productivity processes when you're documenting a patient encounter. So 2-in-1 is a good fit in a healthcare environment and enables streamlining those workflows. So when you're rounding, you can use that as a tablet. When you go back to your office and do the documentation, you can use it as a laptop. Wireless connectivity for 2-in-1 devices means you no longer have to struggle with that nest of wires when you're trying to connect to a large screen for documentation, which many times is required by the EMR systems. The ability to do multitasking, meaning I can have multiple applications running at the same time, is critical, and 2-in-1 devices enable that. The ability to do EMR data, do imaging, do emails, do video teleconferences all at the same time. These are all critical in terms of care coordination and workplace transformation. And remote access to the data is critical, and having that mobility option in a 2-in-1 is enabling that remote access and improving patient outcomes. There are 5 good reasons to talk to your customers about PC refresh today, especially with the latest generation of Intel Skylake or 6th generation core processors. Without getting bogged into the technical details, your IT customers as well as your clinical customers are going to appreciate some of these enhancements in the new generation. There's a much improved performance on these devices. It is a 183% improvement over a 5-year-old PC. That means I'm doing things almost twice as fast as I did previously. Much longer battery life means I can run an entire shift on a device without having to recharge. And that's critical when you're doing workflows as a nurse and you're seeing patients on a continuous basis all day long. As we look at security, enhanced security is enabled with things like Intel Authenticate. Enabling multi-factor authentication means I can get logged on, I can do my job much more quickly. As we look at the cost to support these devices in the IT environment, it is a much more expensive device to support after 4 to 5 years, so refreshing now means I can drive those costs down by upwards of 90% for our IT customers. And then when we talk about form factors, you look at things like all-in-ones, mini computers, 2-in-1 devices come in all different screen sizes from our OEM partners, so having those choices is critical to satisfying our various customer needs. Intel Skylake Business Platform has a number of enhancements and capabilities. Authenticate technology for security, meaning multi-factor authentication is enabled. Streamlined docking with wireless docking, or what we call WiGig, enables nurses and doctors to do their rounding without having to plug wires in. Having enhanced visualization and graphics with Intel Iris graphics means the user experience is much improved. You can see crisper, sharper images, leads to better outcomes and better patient satisfaction. Multiple form factors from the OEMs means you have choice, you have different price points, and you have different partners you can work with depending on who your customer is. And then collaboration with Unite technology. This is a software capability that Intel developed and has transitioned to the OEMs to offer to the market. This means you can do wireless display in a patient room, in a conference room. You can do peer-to-peer wireless screen sharing from anywhere in the world to another point on a corporate network. That means you can do collaboration in real time, and as we look towards patient care teams, collaboration is a key capability that healthcare needs. Intel Pro SSDs improve the performance and the security on mobile devices. They do this through improved performance. You have 6 times better performance on an SSD flash drive than you do on a hard drive. You get 90% better battery performance. That means you can run your 2-in-1 device all day long. I have higher reliability with SSDs. That means I don't have to worry about IT support costs nearly as much. And I have improved security with Remote Secure Erase. IT folks can remotely wipe the drive on a mobile device, and this is built into the Intel Pro SSD family. Intel Unite is a software capability that was brought to market recently that enables real-time collaboration and wireless screen sharing. Now what that means is, as a physician enters a patient's room, if they use Unite software, they can wirelessly display the contents of their screen on a display in the patient's room. This moves the IT technologies from between the patient and the doctor and enables better collaboration with patients and their care providers. It also enables collaboration both in the room and remotely. You can bring somebody into a virtual conference with Unite software, do annotations, do screen share, and you can do it from anywhere in the world on the same corporate network. So collaboration is enabled through Unite software. Wireless docking is something that can give care providers much more value from their mobile device, a two-in-one device. In terms of how you can use wireless docking, things like patient rounding, where a doctor or a nurse is going from room to room, the ability to wirelessly dock that machine, do the patient encounter, and then document the information without plugging wires in, speeds up their workflow. That means they're going to see more patients. That means we're going to deliver better care. It also can be used as part of their documentation process when they're actually in their offices. To go into the office, have wireless access to peripherals, makes their user experience that much better. And then things like collaboration. In a conference room where you're sharing with your peers, you can wirelessly dock, screen share, and review materials from your screen onto a large display. Mobile devices can also be used to improve the inpatient care experience in the hospital. By providing a mobile device at the patient bedside, patients now have access to information about their care. They can coordinate with family members who maybe are going to be visiting them. They can also have access to information about their care, as well as entertainment devices that may be in the patient's room. This is a trend we see growing. Patient engagement solution providers are developing new solutions that include both information, education, as well as entertainment assets for television and video watching while they're in the patient room. So getting that patient engaged in the process of their care while they're in the hospital is enabled using mobile devices. Mobile devices can also be taken out of the hospital by patients for continuing care at home. And this is a critical aspect of patient engagement outside the four walls of the hospital. When the patient can actually access data at home, ask questions, communicate with their care provider from home, this leads to better outcomes and reduced costs. The provider has better information, the patient has peace of mind and satisfaction knowing that they're getting the best care possible at the lowest cost possible because they're still at home. So mobility and mobile devices like Intel 2-in-1s make that a reality. Intel Authenticate is a security technology in the 6th Gen Core vPro platforms. What does that do? It means you can harden security credentials at the hardware layer, meaning it's more secure. It's at a lower level than the software credential typically used in IT environments today. The number one threat for healthcare in terms of security breach is password and credential breach. And so Intel's working on ways to improve security in that way. Multi-factor authentication, using multiple factors to access that critical data, enhances the user experience and improves the workflow. So using things like a fingerprint scanner instead of just a password to get access to that data is enhanced through Authenticate technology. It improves the user experience, it improves and streamlines the workflow in the clinical environment. Intel is enabling remote management for the IT folks for PC management with AMT, or Active Management Technology. This is a capability that's in vPro branded platforms. And what it means is IT folks can now remotely manage PCs without having to physically touch them. They can remotely patch software, they can remediate problems, and users are much happier because IT can get them up and running that much faster, speeding them on to their next patient experience. So look at your customer's environment, talk to them about AMT, and see if this is something the IT folks might want to take advantage of to improve the support of their PC fleets. One of the trends that we're seeing in healthcare is the move to virtualized desktop environments. What that means is moving the data from the PC at the edge to the data being stored in a data center, and this is primarily for security of data. If your customers are doing virtualization, I want to let you know that Intel's got virtualized, tailored thin client options from the OEM. So now you have an Intel-based platform that you can use in a thin client required virtualized desktop environment. There are a number of OEMs who are supporting Intel-based options. I've included that information as part of this material. So please talk to your vendor partners and the OEMs about their thin client options on Intel. So in summary, your customers in healthcare are looking at mobility and mobile devices. Talk to them about what your options are for an Intel-based solution for mobility, both in the hospital, in the acute care setting, in community care settings, and patients taking mobile devices at home. Talk to them also about wireless collaboration capabilities, things like Intel Unite, wireless screen sharing. This improves the workflow and streamlines the ability to collaborate in a workplace where doctors and nurses need to collaborate and talk to each other on a daily basis. Talk to them about things like wireless docking, the ability to streamline that workflow as doctors are rounding and nurses are going from workstation to workstation. And also talk to them about some of the resources that are available online. There's some links provided here, so you have a selector tool that Intel provides to look at the various options for mobile devices. And if you have a customer who's doing virtualization, talk to them about the Intel options for thin clients on Intel. There are a number of OEMs who are providing great solutions today. So in summary, when you are engaging with your customers and you want some support, talk to your Intel counterparts, bring them into your conversations, and we'll share what we're doing to enable collaboration and mobility in healthcare. To find out more about how Intel can help you to provide personal healthcare solutions, please sign up for the other videos within the Ingram Micro Intel Healthcare Plus campaign. Actionable big data analytics in healthcare, Intel in healthcare, making it personal, breach security solutions in healthcare, and the future of healthcare technology.